Hello friends, this is Dr. Ravi Saini. Today we are going to discuss about RCT. So, randomized controlled trial. The randomized controlled trial is one of the simplest but most powerful tools of research. The randomized controlled trial is a study in which people are allocated at random to receive one of the several clinical interventions. On most occasions, the term intervention refers to treatment, but it should be used in much wider sense to include any clinical maneuver offered to study participants that may have an effect on their health status. So RCT, in simple language, we get an information like a study in which the participants or subjects receive any kind of intervention at random. There is no biasness or there is no fixed pattern by which they would receive any intervention. So that is randomized controlled trial. In most of the occasions, that intervention could be any clinical maneuver which would be offered in that respective study have any kind of effect on the health status. Such clinical maneuvers include prevention strategies, screening programs, diagnostics tests, interventional procedures, the setting in which healthcare is provided, and educational models. So all these uh, maneuvers would come into the category of intervention. Now, randomization. Randomization is the strength of randomized control trial. As I mentioned earlier, that in that any intervention would be given at random pattern. There is no fixed pattern. So this would ensure the quality of randomization control trial. Random allocation means all participants have the same chance of being assigned to each of the study groups. So any participant could be assigned into any study group. The allocation therefore is not determined by the investigator, the clinician, or the study participants. So the allocation is not, there is no role in case of allocation by investigator, clinician, or any study participants. The purpose of random allocation of participants is to assure that the characteristics of participants are as likely to be similar as possible across groups at the start of the comparison. If randomization is done properly, it reduces the risk of a serious imbalance in known and unknown factors that could influence the clinical course of the participants. So, if randomization is done properly, then it reduces the risk of any biasness which could influence the final result of the study. No other study design allow investigators to balance these factors. Randomized controlled trials classified according to the different aspects of intervention evaluated. So in that we have two categories. First one is the explanatory or pragmatic trials. The second one is the efficacy or effectiveness trials. So in the first one is the explanatory or pragmatic trials. Explanatory trials are designed to answer a simple question: does the intervention work? So if it does, then the trial attempts to establish how it works. Pragmatic trials, on the other hand, are designed not only to determine whether the intervention works but also describe all the consequences of the intervention and its uses under circumstance. So, in case of explanatory, the first question is, does the intervention work? But in case of pragmatic, not only there is a question about the intervention, but how it works is also observed. The second one is the efficacy or effectiveness trial. Randomized controlled trials are also often described in terms of whether they evaluate the efficacy or effectiveness of an intervention. So, efficacy refers to interventions carried out under ideal circumstances, whereas effectiveness evaluates the effects of an intervention under circumstances similar to those found in daily practice. Efficacy means the interventions carried out under ideal circumstances, but in case of effectiveness, it evaluates the effects of an intervention under circumstances which are similar found in daily practices. Now, randomized controlled trials classified according to participants' exposure and response to the intervention. These type of randomized controlled trials include parallel, crossover, and factorial designs. In case of parallel design, most randomized controlled trials have parallel designs in which each group of participants is exposed to only one of the study interventions. In case of crossover designs, it refers to a study in which each of participants is given all of the study interventions in successive periods. In case of parallel, there is only one intervention is assigned to participant, but in case of crossover designs, all the intervention is given to participants at successive intervals. In case of factorial design, a randomized controlled trial which has a factorial design when two or more experimental interventions are not only evaluated separately but also in combination and against a control. So that one is the factorial design. Now, randomized controlled trials classified according to the level of blinding. In addition to randomization, the investigator can incorporate other methodological strategies to reduce the risk of other biases. These strategies are known as blinding. The purpose of blinding is to reduce the risk of ascertainment and observation bias. An open randomized control trial is one in which everybody involved in trial knows which intervention is given to each participant. So blinding means it is a procedure by which we ensure that there is there is no certainty by which a participant, the study observers would get to know that which intervention is given to which participants. So this is called blinding. It ensures any or it avoids any biasness in study. Sorry. So in case of open randomized control trial, everybody knows which intervention is given to which participants. In case of single blinding randomized control trial, where the individual involved in the trial study does not know which intervention is given to each participant. So in case of single blinded means the participant would not know which intervention he is getting. In case of double blinded randomization control trial, the participant and the physician both don't know which intervention is given to which participant. Apart from that, there is a triple blended blending also, in which the patient or the participant or the subjects, the treating physicians and the study investigators never know which intervention is given to which subjects or participants. So this one is the triple blinding. A randomized controlled trial is a form of scientific experiment which is used to control factors not under direct experimental control. Examples of RCT are clinical trials that compare the effects of drugs, surgical techniques, medical devices, and diagnostic procedures or other medical treatments. So, randomized controlled trials or RCT are prospective studies that measure the effectiveness of a new intervention or treatment. Although no study is likely on its own to prove causality, randomization reduces bias and provides a rigorous tool to examine cause-effect relationships between an intervention and outcome. This is because the act of randomization balances participant characteristics, both observed and unobserved, between the groups, allowing attribution of any differences in outcome to study intervention. This is not possible with any other study design.